Hospital and Clinical Pharmacy Chapter 2. Different committees in the hospital. Pharmacy and Therapeutic Committee PTC. Introduction. PTC is an advisory group of physicians, pharmacists, and other medical staff. They make policies regarding the drug used in hospital. Objectives of PTC. 1. Advisory objectives. To make policies regarding drugs, to evaluate and select the best drugs for therapeutic usage in hospital. B. To provide guidance to pharmacists about drug distribution in an efficient way without mistake and wasting time and energy. C. To aware the hospital administration and medical staff about the problems or related drug usage, especially experimental drugs. 2. Educational objectives. To examine adverse effects of the drugs and offer new formulary system. B. To provide up-to-date information about drugs and their usage to satisfy the demand of policy-maker professionals. C. To plan training program for staff regarding the drug usage. Composition of PTC medical staff. Department of Pharmacy and Therapeutic Committee. Subcommittee. 1. Neoplastic. 1. Anti-infective. 1. Gastrointestinal. 2. Cardiovascular. 2. Diuretics. 2. Endocrinology agents. 3. Hypotensive. 3. Laxatives. 3. Analgesic and antipyretic. Functions of PTC. 1. It acts as an advisory council to the medical staff and hospital administration regarding the therapeutic use of drugs. 2. It develops a formulary of drugs and prescriptions to be used in hospitals. 3. It suggests written policies and procedures regarding the selection, procurement, storage, distribution, and therapeutic use of drugs. 4. It establishes suitable educational schemes for the hospital staff regarding the therapeutic use of drugs. 5. It studies the problems related to drug distribution and administration. Role of pharmacist in PTC. 1. Pharmacists are important to make the formulary, because they can ensure safe, effective, and affordable drug use. 2. They examine scientific, clinical, and economical data. 3. They convey the staff to obey the decision taken. 4. They create a schedule for committee meeting. Hospital formulary. The hospital formulary is a list of evaluated and selected drugs with their important information to use or distribute in a hospital. Procedure for development of hospital formulary. To make a hospital formulary, the first step is to form a good PTC. The PTC develop a formulary in written form. This committee take decision on 1. The type of publication of formulary, hospitals. 1. Formulary or purchased formulary services. 2. Fixation of rules which the PTC required during evaluating and selecting the drug for formulary. 3. Addition of other content like a prescription writing. B. Uses of drug. C. Table of metric weight. 1 gram equals 1000 milligrams. D. Table of common laboratory values. BP 120/80ths. E. Calculation of dosage for children. 4. Type of format of formulary. Size, loose leaf, bounded. Addition and deletion of drugs from hospital formulary. It is an important step in maintenance of hospital formulary. Criteria for addition and deletion are: 1. The medical staff should approve the drug to be added in formulary. 2. The drug should be recognized by the pharmacopoeias. 3. The drug manufacturer should hold a license, and he should not have been punished for any serious offense under any law of drug and medicine. 4. There should not be used secret ingredient in drug which is not labeled. 5. The drug containing multiple ingredients should not be added in formulary, if the same therapeutic effect can be obtained by a single ingredient drug. Infection Control Committee (ICC). It is a committee to prevent and control healthcare-related infections by making infection control policies and monitoring practices to reduce these risks. Nosocomial infection equals patient get infection inside the hospital. Objectives of ICC. 1. To understand the methods of infection control. 2. To understand the reason of nosocomial infection. 3. To reduce the danger of infection for patients, medical personnel, and guests. 4. To conduct antimicrobial program and instruct the medical staff, patients, and guests. Asterisk function, same the objectives. Role of pharmacist in preventing antimicrobial resistance. Antimicrobial resistance is the ability of microorganisms to protect them from the effect of antimicrobial drugs. This resistance ability they develop themselves or developed naturally. Overuse of antibiotics is the main reason of AMR. Antimicrobial resistance. Role of pharmacist in preventing AMR. 1. He/she should distribute medicine in safe and appropriate manner. 2. She raises awareness on the risk of inappropriate drug use. 3. He control the infection by decreasing the infection transmission. 4. He guide hospitals on the selection and use of suitable antibiotics, disinfectants, and sterilants.